Patients' heads vary enormously in shape and size. We have developed a number of different size caps to accommodate these varying sizes. We have small, which is red, medium, purple, blue is large. Before placing the cap on the patient's head, push all the hair back and around the ears. Position the front of the cap approximately 2 mm below the hairline on the patient's forehead. The three key areas that we are looking for are: number 1, the cap is not too small. It is important that the top of the cap is touching the crown of the head, otherwise crown hair loss will occur. Number 2, hairline. The cap needs to fit around the entire hairline and needs to be tight. Number 3, the cap is not too big. If the cap is too large, it will be loose fitting and you will be able to put your hand up the side and or the back of the cap. Place a towel around the patient's shoulders. Lightly dampen the patient's hair using lukewarm water. Apply a small amount of conditioner to the dampened hair. Comb the patient's dampened hair back using a wide tooth comb or fingers so that the patient's front hairline is visible. This is especially important for patients with bangs. Position the elasticated headband below each ear and on the forehead to create a barrier between the cap and the patient's skin. This will reduce any discomfort. Fit the required inner silicone cap to the patient's head. Line the front of the silicone cap up with the hairline and around the ears. Turn the outer cap cover inside out. Place the inside out cap cover on top of the patient's head and silicone cap, placing your hand on top to hold in place. Roll down the cap cover, ensuring all the inner silicone cap is totally covered. Fully tighten the chin strap to set the cap in position. Pull tight on the bungee cord at the back of the cap and lock in place utilising the bungee cord toggle. Loosen off the chin strap completely and either leave in position or place on top of the head. Pinch together the edges of the silicone cap. Insert the pinched cap inside the cap cover. Push the silicone cap sides outwards and pull the cover up over the cap so that it fully covers the silicone surface. Ensure that there is a snug fit between the cap cover and the silicone cap. Lift the front part of the cap cover up so that the silicone cap is visible. Fit the cap to the patient's head while standing directly in front of them to ensure the cap is on straight. Align the front of the silicone cap with the hairline and around the ears. Replace the cap cover rim below the ears once you are happy with the cap position, ensuring none of the silicone cap is exposed. Fully tighten the chin strap to set the cap in position. Pull tight on the bungee cord at the back of the cap and lock in place utilising the bungee cord toggle. Loosen off the chin strap completely and either leave in position or place on top of the head. When connecting the couplings, the male and female connectors should be held with one in each hand and simply pushed firmly together to connect. A click will be heard when the couplings are successfully connected.